This presentation is entitled The Basics of Infectious Disease, Infection Control, and Universal Precautions. So universal precautions are specific safety measures designed to prevent harmful bacteria and viruses from infecting people who are providing first aid or health care. Since many of us and many of our staff provide direct support to people we serve, it's imperative that all staff use universal precautions when providing care. Universal precautions, as stated by the Center for Disease Control, should be used at all times to avoid transmission of infectious diseases that are exchanged through blood and other bodily fluids. Procedures include appropriate hand washing, food handling, use of personal protective equipment, disposal, care of contaminated items such as needles, clothing, bedding, tissues, etc. Hand washing. When you wash your hands, you wash away bacteria and viruses that you have picked up from the environment. Washing your hands well will prevent the spread of this bacteria and avoiding illnesses. Appropriate hand washing methods include wet your hands with warm water and apply soap. Scrub your hands together briskly, get under fingernails and between fingernails. Wash your hands for 10 to 15 seconds. A way to measure this time is sing Old MacDonald or Happy Birthday one time through. Rinse hands thoroughly with a clean paper towel. Use the towel to turn off the faucet and discard. If you do not have immediate access to a sink and soap, if possible, carry a waterless antibacterial hand sanitizer with you. Hand sanitizer should be used temporarily until you are able to wash them thoroughly. Wash your hands whenever they appear dirty, before and after preparing food, before and after eating, after using the bathroom, after touching pets, and after blowing your nose. Food handling. When preparing food, it is imperative to wash your hands. Otherwise, you will ingest a bacteria or viruses that were previously on your unclean hands. Some bacteria grow faster once they get into your food. When serving food, keep food covered until served. Pick up utensils only by the handles. Do not touch the inner surface of glasses or plates. Wear gloves or other personal protective equipment to prevent bacterial exposure. Personal protection equipment is specialized clothing or equipment worn by an employee for protection against infectious materials. Personal protective equipment. The following equipment should be used in compliance with universal precaution procedures: gloves, gowns, aprons, masks, face masks, and protective eyewear. PPP continued. Gloves are the most commonly used protective equipment. They should be used to avoid contact with blood or other bodily fluids when handling contaminated items, when there are open cuts, scratches, or wounds on the person you are serving or on your own hands. Be sure to wash your hands before and after you use gloves. Gloves serve as a protective measure, but you still have the responsibility to perform proper care. Gloves should be changed every time you come in contact with a new person or activity. Approximately 5.6 million workers in health and direct care industries are at risk of exposure to bloodborne pathogens such as human immunodeficiency virus, HIV, the hepatitis B virus, HBV, and the hepatitis C virus, HCV. There are procedures that are required for direct care workers to follow to protect themselves and the people they serve from exposure. Always use universal precaution when providing direct care to anyone. You may not know the health status of a person, so again, use proper care. Report instances of scars, cuts, bites, marks, or scratches that may occur from person to person. Medical attention may be necessary. Treat all human body and certain body fluids as if they are infectious. must be observed in all situations where there is a potential for contact with blood or other potentially infectious materials. These are the primary methods used to control the transmission of HBV, HCV, and HIV. When occupational exposure remains after work practice controls are put in place, PPP must be used. Examples of PPP are gloves, aprons, masks, etc. Also, properly dispose of all contaminated items to prevent exposure as well. Discard any contaminated needles or other sharp instruments in appropriate containers. Dispose of any used items such as tissues, napkins, hand sanitizers, clothes. Dispose or care for contaminated laundry. Disposal and care of contaminated items. So some examples are soiled linen. They should be bagged and transported in a manner to prevent leakage. Sort linen before washing. Use gloves to sort. The settings on household washing machines have been found to be sufficient to ensure patient safety. Use additives at the appropriate amount of adequate wash and care. Disposal and care of contaminated items. Other tips are wash hands prior to and after handling laundry. Use a robe if necessary and available to protect your own clothing from contamination. Launder your own garments after you work. Also, be mindful of lifting procedures when carrying heavy laundry baskets. Back safety is important. Emergency protocols. Please contact emergency personnel in the event of a fire, a serious injury, a missing person. Also, know your agency's procedures about reporting incidents and contacting emergency personnel within your agency. Emergency protocols. Do you know who to contact in the event of an emergency? How to contact he or she or them? What indicates an emergency? And in the event of a fire, the evacuation plans for your home or agency. Safety measures. Warning devices should be available in the home or agency. For example, some smoke alarms and carbon monoxide detectors. Check the devices regularly to ensure proper functions. Other safety measures include lifeline alerts, security alarms, and residential sprinklers. All of this information can be referenced on the Center for Disease Control and Prevention at www.cdc.gov. Any questions about universal precautions should be discussed at this time. Thank you so much for watching this, and I hope that you and your organization learned something new. Take care and be safe.